are plotted against the weeks of your pregnancy. Plots come between 3 centiles. The upper centile is the 90th, the middle is the 50th, and the lower centile is the 10th. So babies should be growing between the 10th and the 90th centile. You can see the normal growth here. So above the 3-line range indicates a large baby. This would indicate the midwife to talk to you about your diet and maybe refer you for a diabetes screen. Below the 3-line range indicates a small growth restricted baby, You can see that the growth of this baby has tailed off. In this case, the midwife would refer you to an obstetrician and would make a plan of care with you, deciding your future tests and investigations and ultrasounds. So there are some things that influence the fundal height of your uterus. You need to make sure you have an empty bladder before your check. It can be the number of babies you've birthed before, the size of your baby, if you have a full bladder, the light of your baby, the number of babies you are carrying, single pregnancy or twins. Babies usually find their position by 30 to 32 weeks. Your midwife will feel your tummy and measure the height of your uterus with your permission. You can tell your baby's position by where you feel your baby's kicks. Your midwife will be able to feel your baby's position well after 32 weeks. Checking baby's position before that time doesn't give us any benefits. The midwife will document your baby as lying posterior or anterior positions. When she writes LOA or LOP, she's looking for the occiput. So if your baby's limbs are felt on the right, your baby's back is on the left. If your midwife feels the baby's limbs are on the left, then your baby's back is on the right. And if the occiput is at the front, then your baby will be either left or right, occipital anterior. So if the baby kicks on the right, the back is on the left, the baby is LOA. If the baby kicks on the left, the baby is ROA. If the baby's kicks are on front of the tummy, the baby is posterior. If your baby's in a posterior position, the midwife may recommend optimal positioning for your baby. And you can check this in the preparing for birth section. If the kicks are lower down in your pelvis, then your baby is breech. The midwife will check the shape of your abdomen or tummy. Don't be afraid to ask any questions. The bulging side will be your baby's limbs. The flatter side will be your baby's back. If your baby is in posterior position, both sides of your tummy will be flat and your baby's limbs will be felt down the center. So feeling your tummy can indicate the size and light of your baby. Tell your midwife where you feel your baby's kicks and it will give her a clue about your baby's position. As we said before, kicks low down may indicate a breech baby. If your baby kicks on the right, we know the baby's back is on the left side. Inspecting your tummy or abdomen tells your midwife a lot about you and your baby. Your midwife will look at your skin texture. You may have hormonal rashes and she will advise you how to manage them. You may have stretch marks and she may advise you about the diet. Your midwife will reassure you about the things that are well, and she will advise you about things that don't appear to be well. She will notice your baby's movements. It's important that your midwife knows how and when your baby moves. It's important for you to connect with your baby. So if you can't tell your midwife about your baby's movement, she'll show you ways to connect with your baby. The midwife will note any obvious scars and ask you about your history and tell her if you've had any previous surgery. If your skin is dry, she'll recommend a diet with oils and nutrients. You might need to up your water and nutrient intake. If you have stretch marks, you may need to increase the zinc and protein content in your diet. Zinc is important for the elasticity and stretching of your skin. You can avoid stretch marks with a good healthy diet of protein, zinc, magnesium, and foods that improve your collagen. If you don't have much abdominal or tummy muscle, you will need to increase your protein intake and build up your muscle. A midwife can tell if you don't have good muscles because she will easily be able to feel your baby through the thin and often flabby skin. You need good tummy muscles to get effective contractions when you go into labour. The position of your baby. Your midwife will feel the top of your uterus to feel your baby's head or bottom. If your baby's breached the head at the top, you might feel some discomfort due to pressure from the hard, round head of your baby. This might cause you lots of indigestion or discomfort because the baby's head presses up against your rib cage. A baby's head is much more rounded and feels harder than the soft bottom. If you feel any of the symptoms, let your midwife know. If your baby is breached, your midwife will tell you the things you can do to change baby's position. Change your diet, avoid fast and refined foods, especially sugars. Avoid too many fruits, strawberries, watermelon and oranges. Change your posture and use a Pilates ball, hands and knees exercises. And emotional, think head down meditation. And you can refer to the turning a breech baby section. Your midwife will feel the sides of your uterus. Feeling the sides of your uterus or tummy gives an insight into the size of your baby, the tone of your uterus, fluid that surrounds your baby, and baby movements. She will notice if you have any unusual tenderness on your tummy or abdomen. Your midwife will note the amount of fluid around your baby. If you have too much fluid around your baby, she will ask you about your diet and maybe screen you for diabetes. The most common cause of too much fluid is a poor diet with too many carbohydrates and unhealthy fats. If your diet is unhealthy, you will need to make changes and reduce the carbohydrates. If you have too much fluid, you will be unable to lie flat. Your tummy will feel very tight, and you may have difficulty breathing. If you have too much fluid, your midwife may order an ultrasound to check your baby to see if there are no other issues and refer you to an obstetrician. A skilled midwife is better than any machine. An experienced midwife will pick up problems very quickly through her observation and clinical skills. If she orders an ultrasound, it is only usually confirms what she already knows. And that's why it's important for you to attend your prenatal visits and get a regular checkups. Your midwife will feel down the sides of your tummy to your pelvis to identify whether your baby's head or bottom is presenting first. It can determine whether your baby's head is flexed or extended. Your baby's head needs to be in a flexed position for an optimal birth position. And she will determine if your baby's presenting part is engaged in your pelvis or not. So when your midwife checks if your baby's head or bottom is mobile, she will say ballotable, or she'll tell you if it's engaging. It may help if you take a deep breath in and blow out whilst your midwife's doing that. One hand is placed on either side of your baby's presentation and slight pressure is applied so that your baby's presentation can be felt. It's measured in fifths, engaged or palpable. Felt above the pelvis, she would write 5p, or below the pelvis, 5 down, or 5e, engaged into the pelvis. So measuring engagement abdominally to your baby's head is divided into fifths. And it is measured in fifths palpable. That's fifths of baby's head felt above your pelvis. Measuring descent vaginally. If your midwife, with your permission, performs a vaginal examination, she will assess the descent of your baby's head through the pelvis. It's measured in its relationship to the ischial spines. She will document it as being -1, -2, or -3 centimeters above the spines, or +1, +2, or +3 centimeters below the spines. She will tell you how far down or up your baby's head is in your pelvis. It's important to do this before performing an assisted delivery to decide whether to use forceps or ventouse suction or perform a C-section. Your baby usually starts to engage into the pelvis from about 36 weeks in a first baby, a bit later for a second baby. Sometimes they don't engage into the pelvis until a few days before labour starts. The timing of when your baby's head engages or descends into the pelvis does not indicate your labour will happen. Babies have a mind of their own, and if they're not ready to birth, they won't. And your body has to go through a ripening process, so that your cervix has to ripen, and that takes time. There are some factors that can affect baby's head engaging into the pelvis. Your baby is in a posterior position, his back to your back. It may be harder for him or her to engage. Your baby has lots of room to move. He or she is less likely to engage. The shape of your pelvis or position of the placenta. If you're expecting a big baby, it's more likely that your baby's head will start to engage when the contractions begin. Eat healthily and exercise. Grow a baby that's proportionate in size to you. Locating lie and presentation of your baby shows the midwife where to place the stethoscope or Doppler to listen to your baby's heartbeat. If it's ROA, the approximate points the baby's head sounds are shown on the image. Posterior, left posterior,